Hi, my name is Donna Moore, and for my priority health issue, I will be talking about osteoporosis. So, an overview of osteoporosis is that it is a disease that affects the bones and it causes the bones to be porous, brittle, and weak. And because the bones are porous, brittle, and weak, it leads the bones to be more vulnerable to fractures and breaking and falls and things like that because of the porous and weaker nature of the bones. So, a target population that I decided to focus on primarily was going to be women. And I did this because women are more likely to be affected by osteoporosis that we've seen in data compared to men, and specifically Asian women who are statistically more likely to develop osteoporosis. So, that is why I decided to focus on women. And also, anyone can really develop this disorder, and it's definitely diagnosed in men and people of different ages. There's a common misconception that osteoporosis is an older person's disorder, but it can really be diagnosed at any stage. It doesn't have to be in the elderly stages of a person's life. So that is really important, is to focus on women and women of many different ages that can develop this disorder. So, the significance of osteoporosis is that there are really no symptoms that are associated with osteoporosis. And what I mean by this is that the symptoms are very general symptoms like back pain, hunched postures, things like that that may not pose a flag to someone until they have a fall. And that's what makes it really dangerous because most people don't know that they have osteoporosis until they have a fall, and then they are looking at the bones, and the bones are very weak or porous and very brittle, and then they get diagnosed with osteoporosis. And this can be harder, especially when people are being diagnosed with this at an earlier age or at an older age. And so when this happens, it can really hinder their ability to establish a healthy routine to strengthen their bones, which is needed. And this can lead to them having a sedentary lifestyle, which is not needed to help osteoporosis, and it will just further the decay of the bones and make them more brittle and weaker. And so it's just a little dangerous that they're not finding out that they have this condition until they break a bone and are in the hospital. So that's one of the significance of this disorder. And another part of the significance is that the number of people that are being diagnosed with osteoporosis has increased over the last decade, especially among women. And then there's a very high number of Americans that are being diagnosed with this. It's around approximately 10 million Americans. So, some challenges that are faced by patients that have osteoporosis, they're under the umbrella of low bone mass and low bone density. And so, with this comes different conditions like arthritis can come with this. And so, some people can have a combination of osteoporosis and the rheumatoid arthritis, and there is a connection that has been seen between the two conditions because they are under that low bone mass, low bone density umbrella, which just causes the bones to be brittle, weaker, more sensitive to different things like that. And this can cause, increased fractures with the arthritis and bone breakages and things like that. So that's a big challenge for people, is developing those two conditions. And then another challenge is that it's harder for patients with osteoporosis to maintain their optimal nutrient intakes. They already are having maybe low calcium, low vitamin D, things like that. They're not getting the minerals that they need. And so once an elderly patient kind of has a fall, they may not be able to take care of themselves as they would be if they were in better health, or if they may not have a good support system to be able to help them with their condition and to get the nutrient levels that they need. And then some patients may be bedridden from a fall, so that can make it difficult to get out and get exercising, which would help their condition. And so nutritional intake is a big part of osteoporosis management and prevention and all those things. And strengthening those bones. And another challenge that I found when I was doing my research was that more women are being diagnosed with this condition than men, and they're being diagnosed at an older age, which just kind of puts them at a disadvantage. Like I said, with them becoming elderly, they don't know until they have a fall. And so that can really hinder their growth from managing their osteoporosis. And also, the more fractures that you have, the worse that the condition can get, because if you have a fall, a fracture, or break, and the bone is damaged from that incident, it can be very hard to kind of, it's like adding more onto a broken table. You're adding more plates and more baggage onto that table. It's going to cause it to never be able to really repair that well, and maybe not repair as fast as it would if it wasn't, if there wasn't that many breakages or falls or things like that. So, a fact sheet that I made, I just included some things about osteoporosis, a little brief overview. And I included that there is approximately 10 million Americans that have osteoporosis that are affected by it. 21.2% of those 10 million are women. And then that's compared to the 6.4% of men that are been affected by osteoporosis. So you can definitely see the big gap between those two categories. And then I also included a little graph that shows the different races of women in America, and we can see that Asian women more likely to be diagnosed with osteoporosis and low bone mass, low bone density, things like that. And then I also included that 75% of hip fractures occur in women, and this is really important because hip fractures and damages can contribute to the development of osteoporosis. Like I said, with the increasing of falls and things like that, can really hinder the development of getting those bones healthy again. All right, so some social media graphics that I made. I made one including some more statistics on here than I did in my fact sheet, but so I put that 8.9 million people. This is the number that represents the fractures that have been caused by osteoporosis each year, and then I did include that 1 in 3 women are prone to a fracture that is going to be caused by osteoporosis. So I wanted this to kind of show that osteoporosis can cause different things, which can lead to harm. And so it's not just, most people think it's just having weak and brittle bones as a result of getting older, but it is an actual serious condition that can cause some falls and things like that. And it can be the cause of a fall, which makes it really dangerous, is that kind of misconception about it. Another graphic that I made is a fact as talks about risk factors. So I included that inadequate levels of the calcium and the vitamin D, those minerals and those vitamins are very important for osteoporosis prevention and helping those bones to stay strong and get strong. And so some people don't even know that they have these low levels until they have a fall or they have a break, which just, kind of doesn't really help their case. So this would be a great social media post to have to inform people, to say when they go to their next doctor's appointment, to check and see what their levels are and to kind of just stay on top of their healthcare. And then I did include some things about smoking and alcohol, which is really important to osteoporosis treatment and condition. The condition of osteoporosis, it can hinder the progression, it can hinder the growth that a patient may have by drinking and smoking. And then a lack of physical activity, which is the opposite of what you should be doing to strengthen your bones. And I included the World Osteoporosis Day hashtag, so that way once they click that hashtag, they can see other posts that are going to be along with that World Health, that the Health Day. So two other graphics that I made. One is like a prevention post to kind of reduce. These are some tips to reduce your risk of osteoporosis. So and getting those vitamin D levels, and I included two ways, which is getting more sunlight, which is going to actually help people kind of get outside, which will kind of help with improving their bones because they're going to be walking hopefully and doing things like that. Which is another thing that I added in my call to action post, is to kind of get people to get active and get walking, because you're getting that exercise in and you're getting that movement in, which is going to be great for your bones and just for to strengthen the bones. But also you're with the support system by, hopefully having some family and friends that they can do that with, and also by getting some sunlight and some vitamin D while doing that. And then I also included getting vitamin D through the diet, which is one important way because they're missing those vitamins and nutrients that they need, which can contribute to their bones being weaker and brittle. And so I just included that to get some more calcium rich foods and vitamin D. And then, like I said, another, kind of hounding that in to avoid smoking and decrease the alcohol consumption and to increase activity with strengthening and conditioning. I tried to make that kind of specific instead of just saying exercise, you know, what should they do to strengthen their bones? And a lot of the research says to do strengthening and conditioning, exercising and training to help with that. So, some online sources that I found that I think are really good. I like to include like something that is kind of more is dense, and then something that's kind of like not as dense. I like very like thorough information, and some people may not. So I just included two things that are really good. Both of these packets are really good information, and I like the first one because it just kind of shows kind of serious. It's kind of like a serious kind of post that she has, and it's just kind of like a serious kind of um, cover for this topic. So it just says when a sneeze can break your bones, and I think that that just kind of simplifies it and shows that this is not just an older person's disease, and that oh someone just gets older and this is what just happens. This is an actual serious condition, and it can be prevented and it can be treated, and that you should it does take a lot of hard work to kind of get someone back from that and to prevent this condition. And then another one that I have over here to the right just shows some things about vitamin D, nutrients, and exercise, and it kind of goes in depth. And these are both from the same resource, which is the IOF, the International Osteoporosis Foundation, which I think they have a lot of amazing resources that I found, which are really good. And some more pamphlets and things like that I found to be really good is from the Bone Health and Osteoporosis Foundation, and the National Osteoporosis Foundation. And so these resources are really good because these all can kind of be put into a doctor's office or clinic. But this little trifold to the right I think is really good because it's kind of quick, and it has some definitions, and so does this Bone Basic packet as well, a resource. And it's, it can be distributed online, but it can also definitely be you can have a physical copy of this, and it can be printed and it can be distributed. And I think it's good because this one to the right has some pictures of what a normal bone looks like. It has what a osteoporosis bone looks like, and a osteopenia bone looks like. So it kind of goes into depth, and it gives definitions and things like that for patients, gives tips and good things and basics, and so kind of gives terms that their doctors or their providers may be throwing around that they may not know. And so it kind of just shows them kind of an eye into what their provider may be seeing to kind of help them to better their health. And that is all I have. Thank you so much for listening. And I hope that I just showed some good resources and just informed you on osteoporosis.